Hello and welcome to this workshop on publication of trachoma survey data run by Tropical Data and the London School of Hygiene and Tropical Medicine. Before we get started, we would like to sincerely thank all our partners involved in the running of Tropical Data. We would also like to thank everyone involved in the creation of this workshop, which was run in collaboration with the Ethiopian Health Ministry and funded by RTI International and Fred Hollows Foundation. Here's an outline of the different stages the course will cover. You will move through these sessions over the course of this workshop. In this session, we are doing the Writing the Introduction section of the course. Let's begin by discussing how to plan your introduction. When deciding what to write about, you can refer to the International Consensus Guidelines on what information is needed for a concise introduction. This is called the Strengthening the Reporting of Observational Studies in Epidemiology, or the STROBE statement. This includes a checklist of information to include for reporting observational studies. The two main points to cover are shown here, and we will review more of the checklist later on in this session. Some of the questions to consider when planning your introduction include: what was the purpose of the surveys? Why are you doing this work to prepare a paper? And who is the target reader? In general, the introduction should introduce all the concepts you are going to cover later in the manuscript. For example, in trachoma prevalence survey papers, the primary purpose of doing the surveys might be to generate reliable estimates of prevalence of disease to guide interventions, change in prevalence of disease after interventions, or WASH coverage among households. Secondary objectives may include displaying methods for review by external observers to demonstrate they meet international standards, and displaying country-specific methods to enable people to learn from each other's experiences. When planning the introduction, it may help if you consider why you are doing this work. Ultimately, trachoma can and should be eliminated to alleviate suffering and improve national productivity. In order to achieve elimination, there is a need for prevalence data in order to help plan interventions. Structuring your introduction to capture these concepts will enable readers to better understand the context and importance of the work. The key points are the background and rationale, and main objectives. If writing about the prevalence of disease to guide interventions, you could talk about why we are interested in trachoma and why we must measure prevalence. Examples include because it causes blindness and increases the barriers to contributing to society, is preventable and currently the target of elimination activities, treatment guidelines are based on prevalence of disease, and elimination criteria are based on prevalence of disease. When writing about a change in prevalence after interventions, you could also mention what treatment has been carried out, whether it was successful, and what further treatment might be needed, wherein you could outline recommended treatments and thresholds for each approach. Finally, if writing about WASH coverage amongst households, you could consider the fact that trachoma is associated with poor access to water, and that the E component of the SAFE strategy is to improve access to water and reduce fly breeding sites. Finally, you should consider who the target reader of your paper will be, and bear them in mind when planning the introduction. Considering their individual perspectives will help make the introduction more well-rounded and hopefully more accessible to those readers. Some examples for trachoma survey manuscripts might include health ministries, dossier review groups, local, national, and regional partners, international policy bodies, scientists, and non-governmental organizations. Now we will move on to discuss the length and scope of the introduction section. Word count limit is determined by the target journal, and you should check this first. We will use the guidelines required for publishing by Ophthalmic Epidemiology, and so the aim is to keep the length of the entire article to around 3,000 words, not including tables, figure legends, and reference lists. It's sensible then to think the introduction should be about 1/4 of that, or 750 words. However, many readers will already know the background to these surveys, so the introduction is arguably less important than the methods, results, and discussion sections. So ideally, you should aim to keep the introduction really succinct and focused, around 300 to 500 words long. Anything not directly related to the content of the manuscript, for example, long discussions of pathogenesis or dynamics of disease, should be kept to an absolute minimum. For example, instead of writing the entire paragraph that you see listed first, We can simply write, trachoma is caused by ocular infection with the bacterium Chlamydia trachomatis, as the rest of the sentence is not directly relevant to population-level surveys for clinical signs of disease. Similarly, in this example, we can distill it down to just the first sentence to communicate effectively what we are trying to say. The rest of the text, though interesting and informative, is not necessary in a manuscript about population studies of clinical signs of trachoma. The next step is to identify where we would find additional information which can be included in the introduction. There are lots of key resources online to help you search for general information on trachoma and previous publications on trachoma from other regions. General academic search engines such as Google Scholar and PubMed are great places to start. After that, previously published GTMP papers can be a valuable source of information and can be useful as a guide for the style and the content of an article on trachoma surveys. Finally, every trachoma survey conducted with the support of tropical data has a protocol document, which has been extensively reviewed, and often these contain lots of useful information that can be recycled into a manuscript. Now we will quickly review common pitfalls. The first common pitfall is referencing. You should reference all statements that contain non-original fact. Citing the original paper for some statements may be difficult. Where you cannot find the original reference, cite a general reference, but try to avoid doing this if possible. For example, the statement, trachoma is the leading infectious cause of blindness, is a broad statement, and it would be fine to use a number of general references here, including WHO fact sheets or general publications that discuss trachoma. WHO documents are often useful references when stating programmatic targets and thresholds. You will need more specific references for more specific statements. If you were to state that risk factors in Ethiopia include altitude, this would require referencing a paper that shows exactly that. Numerous referencing software programs exist to help you organize all the references you use in a manuscript. Mendeley is a free referencing software that allows you to save references, insert them into text, and format them depending on the type of referencing style you wish to use. It is very useful, and it has a number of easy-to-follow user guides for downloading, installing, and using the software. See the link in the video description for downloading Mendeley onto your computer. The next common pitfall is plagiarism. Direct copying of text or images is plagiarism. You should not copy text. Journals actively check for plagiarism and take it very seriously when found. If you are struggling to find a new way to say something, consider whether it actually needs to be repeated. Sometimes you can cite a summary document to avoid needing to repeat lots of information. For example, when discussing the role of antibiotics in trachoma, it is not necessary to go into great detail. Instead, the paper that appears on the screen now, Evans et al. From 2019, can be summarized in a sentence or two. All your sources that you use must be cited. Next, we have technical statements. It's important to the academic credibility of survey articles that we reflect the current understanding of the technical aspects of trachoma. We've outlined some common slips when talking informally about trachoma here. For example, people sometimes talk about trachoma being transmitted, but trachoma generally describes the clinical signs of disease, whereas it is actually the infection that gets transmitted. So instead of saying trachoma is transmitted, you should say ocular Chlamydia trachomatis is transmitted. Another example is when speaking about the clinical signs of TF. TF is characterized by follicular inflammation, but it has a specific definition, whereas follicular trachoma is undefined and is not a term that should appear in an academic publication. Similarly, TF does not always mean infection is present. So instead of writing, the prevalence of follicular trachoma in the last survey was 10%, or the prevalence of infection in the last survey was 10%, you should write, the prevalence of trachomatous inflammation follicular, or TF, in the last survey was 10%. Finally, people can sometimes misquote the global target for elimination as a public health problem as an eradication target. These are distinct terms and have different meanings, so we should be careful about using them interchangeably. So instead of writing, to achieve eradication of trachoma, the prevalence of trachomatose trichiasis must be less than 0.2%. You can write, to achieve elimination of trachoma as a public health problem, the prevalence of trachomatous trichiasis unknown to the health system in people aged 15 or older must be less than 0.2%. The final common pitfall is abbreviations. These should be defined at first use and then used consistently henceforth. An example is this sentence. The prevalence of trachomatous inflammation follicular, or TF, was 20%. The prevalence of TF is now 10%. Here, we write trachomatous inflammation follicular out in full the first time we use it. We define TF as the abbreviation, and then can use TF in the text. Finally, we suggest a general format that your introduction could follow. Your introduction section should have a general relevant background, a specific background for this particular manuscript, and an aim or hypothesis section. Hopefully by now you have identified an authorship group and the data to be included in your publication. Your task before the next video session on writing the methods is to draft up an introduction section for your manuscript. Thank you very much for listening. We hope you have found it useful and look forward to seeing you in the next session.